Alright, this is intramuscular and subcutaneous medication administration. Today I'm going to show you the intramuscular way. Subcutaneous is pretty similar. You can use a little shorter needle and then you'll go in at a lower angle. We'll get started here. First thing we want to do is make sure we have all of our equipment. We do have a medication that we're going to give. Got our syringe, appropriate needles there for giving that. Have an alcohol prep pad here. Have our sharps container over here. And then we also have some gauze bandages and some tape here to cover up the site afterwards. And I've went ahead and cut my tape and got it down here ready to go. First thing we want to do is take our medication and check our 5 rights, make sure it's the right patient for the medication. It is the right medication that we're desiring to give. It is the correct dose and concentration, and today we're going to be giving 1/2 milliliter of this. And then it is the right time to give it to the patient, and it is the right route, so we're going to be giving it intramuscular. We want to check our medication, make sure it is the right medication as we said, make sure it's not expired, and make sure it is clear, there's no particulates floating around in there or anything like that, and make sure we do have a nice clean cap here still on. We'll go ahead and get our syringe and needle ready. We're going to use a 3 ml syringe with this. Some of them come pre-attached to needles, some of them don't, so we'll want to determine that. And we're going to use this 21 gauge 1.5 inch long needle today. We're going to use that to actually give it, and then we're going to use this 25 gauge 1 inch needle to draw up our medication. So we're going to do that, keeping it all clean, and go ahead and attach that to that. Attach the needle to the syringe. Go ahead and remove our top there, and we can cleanse the top of that with an alcohol prep pad. If there's any reason that it might have been contaminated or anything like that. Remove our cap there. We'll actually put just a little bit of air in there and then draw up the medication that we need, the amount of medication that we need. We'll set that aside and make sure we have it for documentation. We can go ahead and dispose of that needle in a sharps container, and we'll get our needle that we're going to use for administering it to the patient. Go ahead and attach that to it. Maintaining cleanliness and sterility with all this as best we can. We'll go ahead and reconfirm that it is the right amount and right medication that we are wanting to give. We're going to give 1/2 milliliter of this. Okay, we've of course already checked that we do have our PPE on. We want to make sure that we have a good site. If we're going to be giving IM, we want to have a good muscle, whether we're using it up in the arm in the deltoid or the gluteus maximus, wherever we're giving it. We'll go ahead and pinch, or if we're using a sub-Q area, we'll go ahead and pinch the skin, and then the medication will go directly underneath the skin at a very low angle. But since we're doing IM, we're actually going to kind of stretch the skin just a little bit there. Go ahead and get another alcohol pad out. And cleanse that site aseptically from the inside out. Alright, and since we're doing IM, we're going to stretch the skin just a little bit like I said, and we're going to insert at a 90-degree angle. Insert it in. Go ahead and aspirate, make sure you don't have any blood return. Checking your syringe, and then you're going to administer that drug. Remove it. You can begin to massage that site, and you want to dispose of that in a sharps container immediately. You're going to be applying direct pressure to it, and then you can also help massage it into the muscle there. Go ahead and take your 4x4s or whatever kind of gauze you might be using. And then you'll cover that site. If you want to just use a Band-Aid, that's possible too. That would be appropriate. And then you'll secure it down. And then you want to check your patient of course, for any adverse reactions and that you are getting the desired effect of the medication.